Here's another question that we often get. Where are all the good patients?
Especially now with the economy.
Yeah, with the economy.
Right.
Tell us.
Yeah. All right. All the good patients are still out there. They're not going to call you right now. We're doing this in December of 2012. Right. We're doing this video shoot in December of 2012. Over the last 4 years, the consumer has been drained of credit, basically, right? You can't run your credit card up and pay it off with home equity anymore because you don't have any home equity. So the change that you're feeling isn't the fact that there's no good patients out there. They're all out there. They've always been out there through this entire recession. They're just not going to respond to your old advertising you used from 2001 to 2006, where cosmetics came, big full mouth rehabs. You could put a fancy ad in a glossy magazine and get phone calls from people. Well, here's the reality, folks. The reality is that those patients knew they could max their credit card and pay it off with home equity. And they knew they were in the market for a full mouth rehab or a smile makeover or veneers or whatever the reason was that they called you initially. That doesn't exist anymore, okay? But those really great patients are still out there, all right? Now the next question is what do those patients want now? Those patients, and we switched all of our clients over in March of 2008. Even the ones that were only promoting cosmetics and full mouth, we told every one of them, people, we have got to shift your perception. Those patients are still out there. They want the core basic staples of dentistry. They want conveniences, technology, family, kids, ortho, emergencies, right? What happens, by the way, I'm just going to have my soapbox here for just 2 seconds. What happens to teeth that are neglected for 4 years? Everybody watching this video is a dentist. You know what the result of that is going to be. And the reason I'm bringing that up is because I just said emergency. The emergency market is emerging. Yeah. Because teeth go bad. There's nothing.
The parts are breaking.
The parts are breaking. Okay. So, but how you promote yourself through this is through going right back to the basics. Those were the basics before 2001 to 2006. And right now, it's definitely go back to the basics. As the dental market improves over the next few years, you slowly fold in more elective procedures. You don't do it all at once.
They're still available, of course.
Of
and
course.
You will, of course, give the patient all of their options.
Right.
But what they're going to choose is going to be just what Mark was talking about, the core staples.
Right.
But in time, eventually, they're going to go, okay, I'm ready to do that short-term ortho you've been talking about.
Right.
6 years.
Right. Dentists can't wait 4 years to hope that the market comes back. They still have to bring patients into their practice, and they still have to bring good, solid patients into their practice.
Right.
Those patients will turn into wonderful cases.
Right.
We have tons of clients who are doing boatloads of good cases now.
Right.
Okay. But when that credit comes back into the system, it's going to be another dental heyday.
Yeah.
I mean, and you add on top of that the emergencies and the treatment that has to happen after an emergency. Forget elective for a second. Just the emergency market is going to be a boom, moving forward.
Right.
So, that's where the new patients are still, the good new patients are still exactly where they always were. They just respond to different stimulus now.
Right. In the good old days, you could actually advertise and attract people who were looking for full mouth rehabs.
Or implants.
Right.
Right.
They still want that.
Right.
But that's not the first thing that you're going to sell them.
Right.
Okay?
Right. Not now.